Hello students, I am Dr. KOMAL RATHORE, Assistant Professor KOMAL, Faculty of Ayurvedic Science in JAYOTI PEET, Women's University, Jaipur, Rajasthan. So today's session we will talk about behavioral disorder part 2. In behavioral disorder part 1 session, we will talk about what is the definitions of behavioral disorder. And now this session we will talk about behavioral disorders. And next session, in this session, we will talk attention deficit hyperactivity disorder. So again recall what is behavioral disorder. When children cannot adjust to a complex environment around them, they become unable to behave in a socially acceptable way, resulting in exhibiting of peculiar behavior, and this is called behavioral problem. So again, go further. Attention deficit hyperactivity disorder. In this condition, before this, we recall types of behavioral problem in children. So I told you before, it's 4 types: emotional deprivation, physical deprivation, and social deprivation and other forms. So attention deficit hyperactivity disorders come in other form. So it is the condition that affect the behavior of children, which is marked by persistent inattention, hyperactivity, and impulsivity. Symptoms: hyperactivity, impulsivity, disorganization, inattention, distraction, and difficulty to making and keeping friends. Disorder caused by social deprivation. Juvenile delinquency. It means it's a crime, juvenile crime. That's called juvenile delinquency is defined as an individual under the age of 16 who fail to abide in law. Management: parents can create small manageable goal for their child, like sitting in a chair for 10 minutes and giving rewards for its completion. Sleeping for extra half hours helps to dealing with restlessness. Start practicing good health habits. Make sure that child gets plenty of opportunities to play. And second is school phobia. Definition: school phobia is also known as school refusal or school avoidance. Children who resist going to school or who demonstrate extreme refusal to attend school for a sustained period of time are said to have school phobia. They demonstrate signs like leg pain, headache, nausea, and vomiting extra. Management: treatment depends upon the cause. Examine the relationship of child and teacher with a peer group. Reward the child for going to school in daily basis. Professional child consultation is needed in severe problems that should not be ignored. And other forms again is speech problem, flutter or stammering. It is influency disorder beginning between 3 to 5 years, probably due to inability to adjust with stress. It is characterized by interruption in the flow of speech, hesitations, spasmodic repetitions, etc. Characteristics of juvenile delicacy. The behavior is marked by violation of law, persistent misachievements, antisocial behavior, and disobedience, etc. Like, uh, like, uh, like children become crime, activity remain hidden, smoking, suicidal cases, not interested in books, unable to fulfill dream, so she will do crime and go into jail. Interventions: Delinquent code seeks to provide protection and save of public and of the minor who has come in the contact with court. Special facility like juvenile corrections homes are there which provide safety and supervision of delinquent child. Family should act as role model and support tiger child always. Cluttering. Cluttering is characterized by unclear and hurried speech in which words tumble over each other. This is awkward movement of hand, feet, body. These children's therapy, dyslexia. It is the disorder of difficulty in articulation which is caused by abnormality in jaw and palate. So conclusion, behavioral disorder include many tensions, reducing activity that appears during childhood at various level of development. This in this educations of parents is the part of this process which helps parents to guide their children and get rid of these disorders. So management, speech disorders are managed by behavioral modification and relaxation therapy. Reassure the child and help in breath control exercise. Speech therapies, common point of managing behavioral disorder. Discipline the child, behavioral modification and strategy of ignoring of child's activity. So we can help out this children to like that of behavioral disorder and make them happy and we will a part of his and her development properly. So thank you. I hope you like that video and it is beneficial to you. Thank you.